I'm Pharmacist Ben, and it's time for another moment of truth. Coronavirus mania is here, but for most of its victims, its symptoms aren't going to be anything to panic about. The real problem with coronavirus is in its tendency to spread, and it arises when the virus is transmitted to people who are chronically ill and predisposed to disease. It's those folks who are likely to run into complications, largely respiratory, which can be severe and even fatal. Nearly 40% of Americans are obese and or diabetic, and those are major risk factors. Likewise, smoking and vaping. Patients with immune issues, including autoimmunity and cancer, are more likely to suffer complications, as well as sufferers of hypertension and heart or lung disease. That's a lot of us. And because these patients can become seriously symptomatic and even have their lives threatened by getting infected from people who may not even know that they're carrying and spreading the coronavirus, it's really important for the compromised to take great care with their health, which of course they should be doing anyway. Luckily, while fear zaps immunity and can make matters worse, there are helpful things we can do to mitigate risks, even if we are predisposed. On our next video, we'll talk about some specific steps you can take to reduce the likelihood of suffering from the coronavirus symptoms. And as it turns out, those steps are not much different from the things we all have to do to keep ourselves healthy, whether we're high risk for coronavirus symptoms or not. That's today's moment of truth. Have a beautiful day. We'll talk to y'all later. Bye for now.